Serves as CEO of the Community Health Centers Association of Mississippi. Prior to his appointment, Mr. Shirley worked for 8 years as administrator of the Cancer Institute of the University of Mississippi Medical Center and has been active in the healthcare industry since 1980. He has extensive experience as director of federally supported community health centers and state-level public health services in the Southeast. Becoming CEO at the association was a homecoming for him. When the Community Health Center Association of Mississippi was established in the 80s, he assisted the director in coordinating activities to meet the various educational, programmatic, and political needs of Mississippi's community health centers. Mr. Shirley has a Master of Public Health from the University of Tennessee in Knoxville and earned his Bachelor of Science degree from the University of Southern Mississippi. Terrence, thank you for joining us today. Katherine Pannel, DO, is an osteopathic psychiatrist and medical director for Right Track Medical Group in Oxford. She is certified by the American Board of Psychiatry and Neurology and serves as chair of the Mississippi State Medical Association. Dr. Pannel also serves as a leading voice for addressing mental health during the COVID-19 global health pandemic and has penned numerous articles which have been published in Kevin MD, the New York Times, and Better Home and Garden. Additionally, Dr. Pannel has fielded local, state, and national media requests to address a myriad of mental health issues associated with the pandemic. Dr. Pannel received her undergraduate degree in biology from Delta State University and received her doctorate of osteopathic medicine from the Kansas City University of Medicine and Biosciences. She completed her internships and residency at the University of Arkansas for Medical Science and the University of Alabama at Birmingham. Katherine, thank you for joining us today. So, Dr. Edney, I'd like to start with you if we could. Could you give us could you give us the latest on where we are with COVID-19 and what the department is doing to help deal with it?
Sure, and good morning. Glad to be with you. Thankfully, we're moving in the right direction. Numbers are coming down, but they're coming down fairly slowly. It's important to understand that we're still above 3 times our community transmission level compared to right before the Delta variant surge hit. Thankfully, deaths have come down significantly, but we'll continue to see deaths over the next few weeks. The Delta variant has hit us hard, but thankfully we're on the downward trend of that. We've gotten community immunity up significantly. We're still only about 46% fully vaccinated, but with the number of individuals who have recovered from the Delta variant, we're probably now up above 75% in terms of community immunity, which is why you're seeing Delta starting to calm down now.
Gotcha. Thank you. Mr. Shirley, tell us a little bit about the Community Health Centers Association and the role that the community health centers have played during the pandemic.
The Community Health, can you hear me? The Community Health Center Association is a member organization comprised of 21 community health centers across the state of Mississippi. We provide our members with training, technical assistance, and advocacy at the state and federal level. At the start of the pandemic, the PCA called upon our partners, especially the Mississippi Department of Health, to assure that health centers had up-to-date guidelines and resources to mitigate the barriers and maximize opportunities to combat COVID. Considering the fact that our health centers provide care to almost 300,000 patients within 190 sites, we were strategically positioned to take a leading role in COVID-19 testing, vaccinations, and treatment for the underserved populations challenged with access to these services. During the initial rollout, they began testing and providing vaccines as soon as they became available, not only in their clinics, but in community settings, schools, and private organizations. They mobilized COVID teams to provide these services. Some deployed existing mobile units, some purchased mobile units, or established modular units at their sites to prevent the spread of COVID amongst the patients. Additionally, all of the health centers implemented telehealth services to facilitate continued primary care during a time when the lockdown was massive. These services still exist today.
Thank you. Dr. Pannel, this is one area that's close to me because my wife is a therapist, but one area that hasn't gotten as much attention is the mental health aspect of COVID. What are you seeing and what can people do to better deal with the situation?
First, thank you for having me. Thank you for having me, but you're right. Mental health has never really gotten attention it needs. And we've really seen that during the pandemic. I think once COVID does die down, I think we're going to be dealing with mental health ramifications. In my clinic, I know I've seen a lot more depression and anxiety, a lot more PTSD. I'm a healthcare worker.
Terrence.
As humans, we like to be in control. We don't like change. Change makes us uncomfortable, and this pandemic has been all about never-ending change, things out of our control, and so we're struggling. We're all uncomfortable, so that's why we have seen an increase in depression and anxiety. Sadly, we've also seen a really large increase in substance abuse. That's how we've unhealthily coped with all the depression and anxiety. I think I saw something on the news this morning where cigarette use, tobacco use for the first time in several years has increased, and they think it's because of the stress and anxiety from the COVID pandemic. But if there's one positive from the pandemic in the mental health field is that the stigma is falling. We talked about it so much more during the pandemic. We're still talking about it, and people are less afraid to seek treatment.
Thank you. Now, Terrence, back to you. The care providers at the local level have the most contact with people, and how are they generating trust with patients and partnering to combat COVID?
Community health centers are unique in that they are patient-centered and in many instances provide one-stop shop care. Patients can see their primary care provider, they can see their pediatrician for kids, dental and maternal care all at the same health center. This builds relationships with patients and engenders trust with the health center over time. Patients trust the health centers to have their best interests at heart and provide the best care to combat COVID. Word of mouth of these services bring others in and present opportunities for community engagement and outreach.
Thank you. And just to follow up, protecting our most vulnerable citizens is very important. What are some ways to address those needs?
Patient education and access to services is key. Our health centers have done a wonderful job in vaccinating the elderly, those with chronic conditions, and those essential workers.
Now, Daniel, can you talk a little bit about what the latest is with vaccinations in the state and the possibility of expanding to younger ages?
Sure. Everybody needs to understand the answer to eradicating the pandemic is vaccination, getting our community immunity up as much as possible. Yes, the vast majority recover from COVID, but in Mississippi, we're still looking at a 2.2% mortality rate. So out of every case of COVID, 2.2% will be dead in 2 weeks. We just crossed a milestone of 10,000 dead in Mississippi in not quite 2 years, and those are Mississippians that won't be enjoying Christmas this year as they should. And many of those were younger individuals. Through Delta, the biggest impact was age 50 to 64, the vast majority unvaccinated. But we've lost Mississippians in every age group, including a 6-month-old. So vaccination is extremely important. Natural immunity helps, it works, but there's too much risk going through COVID without being vaccinated. Long COVID is 10% of everyone who is infected, and so we will be looking at a significant level of disability in Mississippi over the next 5 to 10 years from people who never fully recover from COVID. Vaccination really is so vitally important, and to protect our most vulnerable, right now we're FDA approved through emergency use to vaccinate down to age 5, and getting our 5 to 12-year-olds vaccinated will go a long way to eradicate COVID, just as it does for measles, mumps, rubella, the other childhood illnesses, and to protect our more vulnerable, older, and very young by getting all of us vaccinated as much as possible. Boosters are now available, and basically if you're over 65, then you qualify for a booster. But if you're 18 to 65 with any health problem, or if you're a healthcare worker, or if you work in a congregate setting like a dormitory, mental health unit, prison situation, then you also qualify. We've given about 125,000 boosters thus far.
Awesome. And just to follow up, COVID's still going on, but we're also in flu season. What's the forecast for this year with that, and how's that going to go?
Yeah, last year first time in 30 years of my practice, flu was virtually non-existent, but that was with the first time in my practice history that people were wearing masks and washing hands and socially distancing. This year, flu is already here, and we've already seen cases of COVID and flu together. You need to understand that when you go to the doctor with flu-like symptoms, everyone is tested for flu and COVID. And that was true last year. And this year, flu is already in Mississippi. Obviously, we're not being as aggressive as we were a year ago with mitigation issues. So it's imperative that everybody get their flu shot as soon as they can. You can have co-administration, the flu and COVID vaccine. So if you do your COVID booster and your flu shot, you can get both at the same time.
And just to clarify, the COVID booster is what, 6 months right after your original shot?
Yes. If you're immunocompromised, you can have a third dose 2 weeks after your second dose. But for the rest of us, if you're getting a booster, then 6 months or more from your last dose and you're good. That's true for all 3 vaccines.
Great, thank you. Katherine, as we look forward into the future, what do we need to do to create a good quality of life as we kind of get back to normal as a result of COVID?
Yeah, I think first, most importantly, we have to accept that this may actually be our new norm, and then slowly adapt to it. I don't think that new norm necessarily means that it's a negative thing. I think if one thing COVID has showed us, it's really put things in perspective for us. We know now what's most important to us. So we need to focus on what's most important to us, be more intentional with time, and really just look to control the things that you can actually control.
So with that, looking forward to that, and for people who are struggling with that, with the new normal, maybe not looking much like the old normal, what do you suggest they do, and how can they cope?
Well, if you put all your healthy coping mechanisms in place, like self-care, exercise, controlling your diet, and you're still struggling, you're still stuck and having difficulties adapting, therapy is a great way to work through it. And you don't have to have a mental illness to do therapy. I think everybody could benefit from therapy. It just helps you take stressors that seem overwhelming, work through those stressors, and come up with ways to make it more manageable.
Yeah, absolutely. Thank you. Now, Daniel, with just looking forward again, how do you see the future of our health systems? I know our hospitals were really pressed during the pandemic and really kind of got in a bind there for a minute. How do you see the future of our health system?
Well, our entire healthcare system has had a stress test last January pre-vaccination, and then again with COVID through the summer. I think most people may not be aware that our hospitals are down 2,000 nurses compared to a year ago. That's based on attrition, retirement, but also being recruited to other states to work COVID and outside states. Going through the Delta variant was the greatest challenge our healthcare system has ever seen, and it was all hands on deck. Just kudos to the Hospital Association and all their partners for doing what had to be done to take care of us through this, and great accolades to our nurses and respiratory therapists who didn't go to Texas, who stayed in Mississippi, who stood firm, and hopefully will be rewarded for that. But it brought out definite issues that we need to do in support of our healthcare system. Our critical access hospitals are in dire need, and if you live in a community that has a small critical access hospital, that's a major employer for your community, and we need those hospitals to stay open, which means more healthcare resources in the state by any way that we can get it. We have to support the staffing of our hospitals, so we have to do whatever it takes to empower our hospitals to appropriately compensate nurses and the ancillary staff, so that should we go through another wave, and we have to assume that there may be others ahead of us, that we never go through what we did with the Delta variant again.
Yeah, we don't want to do that again for sure. Terrence, how are your members dealing with responding to misinformation that might be out there and combating that? I know social media is a big driver of that as well.
And the biggest thing is that we take the politics out of the messaging, and we definitely keep up with the data, and we promote the science. And so that is the main force that we can do is speak the science and not the politics.
Absolutely. And then, Katherine, from the State Medical Association's perspective, what role can our business community play in helping overcome the pandemic? How can these guys help?
We just urge employers to really encourage vaccinations amongst their employees. We know that the only way we're really going to ever get out of this COVID pandemic is via vaccines.
Thank you. And Dr. Edney, just real quick, I wanted to follow up with going back to the vaccines. And on that note, so you mentioned children can now are able to receive it. How does that? Do they get it through their primary care provider? Do they have the drive-through clinics? How does that?
Yeah,
Just all of the
great
above?
question. There will not be drive-through clinics anymore, but every county health department has vaccine and can vaccinate children as well as do our boosters. We have a large push for our pediatricians and family medicine clinics to be able to administer the pediatric doses. As you can imagine, as a grandfather, I would prefer my grandchildren to be vaccinated at their doctor's office, but they're widely available through all the pharmacies. If you go to vaccines, plural, vaccines.gov, then it has a vaccine finder. You can put your zip code in. It'll tell you every vaccine provider in your community and what vaccines are available there.
All right. Well, thank you all three so much. I appreciate you joining us today, and thank you all.
Thank you.